wave in the sea. So it goes on rippling like this. It can transfer by just by dislodging the whole amount of biofilm or the whole colony of bacteria from the substrate, and again go to the biofilm, again become a planktonic cell, and again recharge the biofilm. So one is a rippling, another is a seeding. A seeding is a whole amount of colony from which only a part of the biofilm breaks out, and a part of the bacterial colony breaks out and forms another colony in some other way or in some other form in some other place by the process of seeding. So you need a seeding, you need a swarming, you need a rippling also. Ripples are like waves. This is a biofilm on a paper. A biofilm is a structure which we cannot see. So don't think that the place where you are sitting, the biofilm is not there. The biofilm is there. The place which you are holding, the thing you are eating also contains a biofilm. But whether this biofilm contains a pathologic bacteria or not a pathogenic bacteria is a question. So this is a biofilm on a paper. It's a piece of paper. Even you see biofilms on a newspaper so read in the morning. This is a biofilm on the lettuce. It's an ACM structure. And this is the Streptococcus mutans which was in the mouth, and now it's invading the arterial endothelial cells. So it's very difficult to treat a biofilm. It gets transferred from the mouth and it goes to the heart valves, it goes to the processes in the body. So how it gets transferred? A very simple, easy process is, if you take a very fine hair-like structure, which is shown here in white, if you take a very fine hair-like structure and you insert it in a place in between the tooth and the gum, it's a very fine place, less than a millimeter of weight. This hair structure or this thread-like structure will go to a place called gingival sulcus. This gingival sulcus is the ultimate source of fine blood vessels. So the saliva is continually in touch with the gingival sulcus. It is continually in touch with the fluid which is in the gingival sulcus. It's called the gingival clavicular fluid. So it's continuously breathing the blood vessels inside the gingival sulcus. So this is one finest and one of the easiest, one of the quickest process of transferring a biofilm from the oral cavity to the blood. So if you see a diagrammatic picture, you see
चाकू का क्या दाम है? जो चाकू है?
चाकू का दाम नहीं, it's a thread-like structure which has been put only to demonstrate that there is a place in between the heart structure, tooth structure, and it's a fine structure. So if you see it in the diagram, you see the tooth, you see the soft tissue, and you see this small amount of circle inside. It's a small circle inside, which is the place from where the saliva contacts with the blood film. So just recall your school textbooks. This is the man who first saw the biofilm, and this year we are seeing what a biofilm is and what it contains. It contains a huge amount of DNA